So we are here for the my ear hurts lecture, basically. This is going to be talking about ear infections and other kinds of stuff, and some of the different things to look out for, things to be aware of, and such. So basically, to get started off, a little bit about me. These are a couple of different things about my qualifications. I'm a board certified chiropractic neurologist, a bunch of different hours in diagnosis and treatment of neurological disorders. I have some specialized training on neurobehavioral disorders of childhood as well. I also have a certification as a chiropractic sports physician and a handful of other ones. But so I've been doing a bunch of different stuff. But anyway, besides all that, the whole reason why we're here is talking about the ear infections. And in general, ear infections with children are going to be self-limiting. It's not something that there's going to be, for the most part, something that's going to last over a super long time. But obviously, everything can be different when it comes to each individual kid. Specifically, again, it's the classic kind of stuff is someone that ends up having pain in the ear and they can complain of it and actually say, "Mommy, my ear hurts." But that isn't going to be the case, obviously, in younger kids. So some of the common signs that you can have with a kid that might have an ear infection would be tugging or pulling at the ears. Obviously, the fussiness and crying, trouble sleeping. They could end up having a fever again, especially in the younger infants and with infants and younger children. Fluid might end up draining from the ear. There could also be issues with clumsiness or even problems with balance. And then there could be problems with hearing or responding to quieter sounds. So the general thing, and we'll talk about this multiple different times, is that in general, ear infections are typically regarded as being self-limiting, which means that most of the time you don't actually need to do anything in order to get rid of them. The treatment used to be that they would do antibiotics on a regular basis in pretty much all cases, but now we know that that's not really the best idea. Again, it depends, and there's certain kind of cases where that is going to be the case, where you are going to need antibiotics, but that's definitely not an all the time kind of a thing. So, but again, the other end of the spectrum is that there are rare cases where severe infections can lead to hearing loss. So any kind of case where there ends up being an infection is going to end up needing to be followed up with the pediatrician or with the primary care practitioner. So this talks a little bit about chiropractors who are treating people who have ear infections, but the thing is that we're not actually treating the infection itself. You'll see as we go on that there can be biomechanical things or mechanical things that can actually be involved. That by doing different kind of things, you can actually help to clear out the ear and drain fluid from the ear. So but when you do that, one of the ways that you can help to drain the fluid from the ear is by manipulating the neck. So that's one of the things that we'll look at here in a little bit. But just a little bit more information about OM, so otitis media, or ear infections, would be again about 60% of everybody, like of all people, will end up having will have it within their first year of age. And then within that year, about 17% of those kids end up having it multiple times. Um, that is way higher than what it used to be. The it used to be a much lower number. So it was an increase of about 250% from 1975 to 1990. There are multiple different risk factors for getting it. One is obviously kids going to larger daycares can end up getting sick. Kids that end up getting exposed to cigarette smoke is an issue. Kids that use pacifiers beyond the age of 10 months, and kids that end up getting formula fed have that to a degree. So there's multiple different things, and it's kind of an issue because the estimates are that it costs society about $5.3 billion per year in direct costs. And then when you talk about indirect expenses, you're talking about $8 billion. And again, this is talking about people missing time from work and other kinds of stuff that goes in with that. There are complications that can happen, like I said, but they're very rare. About 1 in 10,000 can get complications like something that's called mastoiditis, which is an infection of the bone that's nearby the ear. And then there's also issues with like meningitis that can relate with, or you can have serious issues like illness or death. So those are obviously major problems. But when it comes down to this, this is one of the pictures that is a good idea to kind of have an idea of what the ear looks like. So to kind of like walk through this, obviously this out and through here is going to end up being the outer ear, right? This is the ear canal as it goes in. This is where people will get earwax. Obviously, you have to be careful. Again, Q-tips, definitely in kids shouldn't be going in here. And again, multiple different people will talk about not pushing Q-tips down into the ear canal because it can perforate the eardrum. Obviously, you got to be careful if you decide that you're going to do that. But this down in through here, this would be the eardrum as it's being cut away. So the eardrum ends up being cut away here. There's these three little bones that goes into the inner ear. So this is the middle ear here. So that would be when they talk about media, this is the middle, right? This is the external ear, which is where people would have issues with like swimmer's ear and stuff like that. But you have these three little bones here, and those bones get vibrated by the tympanic membrane or the eardrum, and when they vibrate, they're going to amplify the sound, and then they push into this area, which goes in here into the inner ear. And this deals with the cochlea, which has to do with sound. And this is basically how you hear. And we could go further into this, but obviously that's not going to be the thing that we're looking at right now because we're not dealing with inner ear infections. But there's a whole bunch of other stuff that you can go on with this. When you look on the inside portion here of the ear, this is the eustachian tube, or this is the tube that when you actually are working with people, this is the tube that's going to connect the inner part, or I'm sorry, the middle ear with the back of the throat. So you have the pharynx that's in the back of the throat, and then you have this tube that connects in between the two. This is why your ears pop when you yawn. This is why they pop when you go up into an airplane, and you go obviously like high up. If you're driving through the mountains and your ears pop, it has to do with the change in pressure, because this has to have air in it, and that air needs to allow this membrane to vibrate the way that it should. If this has too much pressure, then it slows this down and it makes sound not work. If this has too much pressure here and there's not a lot of pressure on the inside, then it doesn't work that way. But you have to have the membrane there to block it from inside to outside so that it actually can vibrate. So that's the general way that the ear is kind of set up. And when you take a look at the next slide, this is kind of like looking at it a little bit more in depth from the standpoint of when you actually have something going on. So again, this is the external aspect. This is going to be the tympanic membrane. These are going to be the different bones. And then this would be something that would be going on where you could get fluid or some kind of junk that's actually in the ear. Now, when we look and we go to the next stage, this is a slightly different view. And again, this is still zoomed in a little bit, but this is going to be where the eustachian tube is here. So the idea is that you end up having this middle ear that's in through here. You have these three bones that are going to be working back and forth, and you have the eustachian tube that's out here through the side. So I think it's always a good idea when we start talking about any kind of this stuff that we just kind of take a look at the anatomy in order to help to figure out what exactly is going on. So after we do all that, then basically we start getting to the point of when you start getting earaches and stuff like that as a kid. Again, some kids get them over and over again, and there's different stuff that affects that. So again, kids are going to get earaches more often than adults do. Again, the biggest time that kids are going to get ear infections is going to be between the age of 6 months and 24 months. And again, that has to do a lot with the way that the head is shaped and the way that the eustachian tube actually sits. It has the tendency to get kinked a little bit more, or you can also look at the eustachian tube being more horizontal when someone's younger, and then it ends up getting a little bit more of a slant, which can cause it to actually drain a little bit better as somebody ages. So there's a couple of different reasons why it happens more in kids. But about 15% of kids will have the tendency to get frequent or recurrent type of infections. And a recurrent infection would be somebody that's getting three or more within the period of like 6 months. So, again, typically, kids will get like 2, 3 ear infections or so. They might get a little bit more if they're going into daycare. But again, um, about 70% of the risk of the ear infections is usually caused by different issues with hereditary type of factors. But there's usually not a lot of stuff that you can do in that kind of situation. But again, some of the ways that you can reduce the incidence of ear infection, I had mentioned some of this, is, and again, not everybody can do this, but breastfeeding for about 4 months would be something that would be good. So uh, things that are like mixed feeds, like using like half of the bottle and then half breast milk, don't necessarily have a protective effect. So the breast milk is going to be a better version, but again, it's not, if somebody can't, there's obviously multiple different reasons why somebody wouldn't be able to do that. But that is the case, is that if you aren't able to breastfeed, there is a slightly higher risk of having ear infections in a kid. Another one would be secondhand smoke. So secondhand smoke or passive smoke in the home is going to increase the risk of ear infections by 25%. And then you start talking about pacifiers. So if the kid is older than age 1 or 10 months, um, you know, again, that would be something that has the tendency to do that. Pacifiers that are used after that age have the tendency to increase the risk of ear infections by about 30%. So there's multiple different things. So again, like I said, the eustachian tubes are a little bit smaller in kids. They're a little bit more horizontal or like level than what they are in adults. And so that just makes it a little bit more difficult for the ear to drain the fluid out, even under a normal condition. Now, if you start talking about other types of issues, like if the eustachian tube ends up getting blocked because there's extra mucus, because there's some kind of upper respiratory infection or a cold or something like that, or if there's some reason due to inflammation that the eustachian tube at some point in it might be a little bit swollen, then you might have a problem with the ability to drain that eustachian tube, and then therefore draining the actual middle ear. So again, the other thing is that kids' immune systems have the tendency to not be quite as effective as an adult because it's still developing. They haven't been exposed to all of the stuff that we have over, like a lifetime. So it doesn't fight infections quite as well. That's why, kids end up having the tendency to, get sick all the time. It's because they're just not used to fighting stuff off. So, as part of the immune system, again, along with all of this other kind of stuff, you also have adenoids in the immune system, which are going to be back in the tonsils. And those adenoids that can respond to bacteria that are passing through, again, if they get trapped in there and you get swelling inside of the adenoids, sometimes that can be close that they can pass it on. And it can get into the eustachian tubes and then up into the middle ear. And also, again, if you're not draining fluid, then that fluid is creating an environment that makes it so that you can actually have stuff grow in it. So there's multiple different things that can happen when it comes to those earaches. So, um, every time that a kid gets the cold or the flu, again, their body needs to drain the secretions that are made in the nose, like all of the mucus and all that other kind of stuff. So, because the eustachian tubes don't really work super effectively, that extra stuff, the mucus that they have, ends up being a really, really good breeding ground for bacteria. So it could be bacteria, but you also create issues where you can get with infection because of a cold. So again, um, either one of those can end up leading to making extra fluid, or specifically with bacteria making pus. And again, you're basically making pus within the part of the middle ear. So, um, but the thing is that, like I said before, every ear infection does not need to be treated with antibiotics. Again, the majority of the time, it's supposed to be that you're supposed to wait and kind of see. Again, many of them will clear on their own. Most kids under the age of 2 will get antibiotics because they have a higher risk of getting complications, and it's harder to figure out when it started, when the symptoms started. Um, and it just can be a little bit harder to clear on its own. But again, with a middle ear infection, all those germs and everything behind the eardrum can put a lot of pressure on that eardrum. Again, it's basically pretty much like a flap of skin, and it's basically pushing out, and it can actually cause that eardrum to bulge, which ends up obviously not being good. And occasionally, because it ends up bulging as much as what it does, you can actually get the eardrum can actually break. It might pop, and that would relieve the pressure, and then you can end up seeing pus and or blood that's draining out of the ear. Obviously, that's not good, but it's not to worry too much because the eardrum is pretty resilient and it will usually heal back up. Um, but again, that is one of those kind of things that ends up being a factor that when you're dealing with it. So the again, talking more about the causes here of earaches is that earaches in one or both ears are usually caused by a minor type of infection, and usually it's going to get better in a few days without treatment. The pain can be described as being sharp or dull. It can be burning, and somebody who's old enough to be able to describe some of this. Obviously, in kids that are young enough, they're not obviously going to be able to express what's going on. But about 62% of children in developed countries will have their first episode of having an ear infection or otitis media by the time that they're age 1. And then more than 80% will end up having one by their third birthday. And then by the age of 5, almost 100% of kids will have an ear infection at some point. So again, this is a whole lot of money that you're dealing with when it comes to the cost that you have with lost wages for parents and the cost for treatment. So it ends up being a whole lot of, of money that's associated with that. So there's specific type of bacteria that are associated with it. It's pneumococcus or streptococcus pneumoniae is typically the type of bacteria that's involved. Again, that's about 50 to 60% of the cases of otitis media. But again, there in some of those cases there might be some types of vaccines that might be recommended, but again, there's always the possibility of, because of the wait and see is one of them, is to be able to actually like use either home remedies or chiropractic care in order to see if that can actually help out. Now, again, you should always contact the general practitioner or like the pediatrician if the child ends up having other kinds of symptoms. If they have a high temperature, if they have fever, if they have vomiting, again, a severe or a sore throat, again, swelling around the ear or discharge from the ear, all of those things are reasons to make sure that you make an appointment and go in and see the pediatrician. If there's anything that's stuck inside of the ear, that's a good reason to go in. And again, if the earache doesn't improve within a couple of days, again, if there's fever that's associated with it, all of those different things are issues that you want to go in. Now, the thing that, like, when it comes to talking about this is that, again, I'm not advocating that somebody not go in to see their doctor. I'm just looking at other types of treatments that might be a possibility during the wait and see to help make it go away. Or especially if a child has had repeated ear infections, sometimes getting adjusted can end up saving the kid from needing to get the tubes. So there's a lot of different stuff that kind of goes with that. Um, so when it comes down to it, again, once the middle ear ends up getting infected, like we talked about, the pus will build up behind that eardrum, and then you can end up having that increased pressure. That pressure ends up causing pain, and then because of that, you can end up getting the pressure behind the eardrum. If it does rupture, then again, pus will come out into the ear canal and come out of the ear, and you can also get scarring that happens within the eardrum itself. So there's multiple different cases that are associated with that. So another thing that can be an issue ends up being cavities. So anybody that ends up having like ear aches due to the fact that there might have been a problem with a cavity or issues with that would be something that it would need to be treated by a dentist in order to get that ear infection to clear up. Damage to the ear itself, again, can be from injuries to the inside. So, like I talked about before, using the Q-tips or anything like that in order to get too far into the ear, that can puncture the eardrum, and then that can cause earaches and problems with that. People that end up having issues with um, the earwax and other kinds of stuff. You can use solutions like Debrox that you can buy on Amazon and other kinds of stuff that you can put drops in the ear and basically help to flush out some of it. Obviously, you need to make sure that there's no like perforations in the ear and stuff like that, but those kind of things can be done. Um, there is multiple different things. So again, earwax that's built up or objects in the ear, again, sometimes that can be part of the ear ache in and of itself. That can also be something that can cause issues with hearing as well. So those kind of things shouldn't be removed by you. What it should happen is that you can go in, to like technically scrape it out. You would want to go in and actually see your primary care doctor in order to try to get that out. But again, you can get those Debrox type of things, the eardrops, in order to help to soften up the earwax in order to get it to be able to flush out. So there's a couple of different ways that you can do that. Again, throat infections or getting sore throat and stuff like that can also be part of what causes earaches as well. So tonsillitis, or maybe there's abscesses that you can get. Those are all things, and reasons to make sure that you're seeing your doctor for it. If you get an abscess on the back of the throat, again, you need to see the pediatrician. Keeping out an eye for consistent types of coughing, getting headaches or headaches that are getting worse, feeling sick or tired, having problems with swollen lymph glands in the neck, are all things that are issues, and even like losing or having the voice change. Um, and then we already talked a little bit about swimmer's ear. Swimmer's ear is when it's in that external ear canal, like where the wax would typically be. That's going to be an infection in the outer ear. It can happen basically due to swimming. It can happen due to bathing. Um, so there's multiple different things. Obviously, it occurs a lot in swimmers because they're basically washing out all of the earwax. So if you get rid of all of your earwax, then you get rid of some of the protection that you have in the ear, and then you can end up getting, basically itching. You could have a pain that intensifies, again, redness around the outside of the ear. You can have a lot of fluid that drains from the ear. There can be pus. There can be, again, ear blockages caused by swelling, debris that can be in the ear, difficulty in hearing, and then you can even have fevers and swollen lymph nodes as part of it. So there's a whole bunch of different things that can be associated with it. But when it comes down to it, again, there are guidelines that pediatricians use when it comes to treating the ear and treating ear infections. So the American Academy of Pediatrics has guidelines for the ear infections, and these are also guidelines that end up being endorsed by the American Academy of Family Physicians. And basically, they set up guidelines that recommends trying to do fewer types of interventions for ear infections, and this first got passed back in like 2004 because again the idea of having too many antibiotics is not typically a good thing, right? It's not good for society in general, and it's also not good for the kids. So again, they get these guidelines get renewed on a regular basis. But basically, currently, the way that it says it is that if the person, again, if you suspect that there's an ear infection and you end up having a problem with it, then you can always go and take your child to the pediatrician to help to figure it out. I'm not asking for patients to play doctor. But what I am saying is that, I just want you to know like the general idea, because sometimes people get used to the fact that maybe they got antibiotics a lot as a child, but that might not be the way that it should be at now. So again, the issues that you can have, again, you can have uncomplicated acute otitis media, again, in kids that are aged about 6 months to about 12 years. Basically, you want to try to reduce the amount of care that you try to do, or the amount of interventions. So again, there's more rigorous diagnostic criteria. Sometimes people will just call it an ear infection when it wasn't necessarily one, or when they were trying to, they would try to just, prescribe it if they saw something that was off a little bit. Now the standards are a little bit higher in order to consider something an ear infection than what it used to be. Um, But the idea is that you want to address the therapeutic options, controlling the pain and then prevention, and then making sure that they select the right type of antibiotics when it comes down to it. So the currently what it says is that the main thing that you should do for acute otitis media or ear infections is going to end up including evaluation of pain and then treatment. That's going to be the main two things. And when it comes to antibiotics, is that they typically only want you to prescribe them when it's a bilateral type of ear infection, or there is a unilateral ear infection in a kid that is at least 6 months old, but they end up having severe symptoms. So again, if there's severe otalgia, which again is going to be the ear pain, or if that ear pain is going to last for 48 hours or longer, or if the person has a temperature of, it's about 39 degrees Celsius. So that's, getting into like the 102 range, I believe. So again, if it's non-severe bilateral acute otitis media in a kid that is 6 months to 23 months, again, those are options that you can end up having when it comes to the antibiotics. So when it comes to looking down or looking at some of these things, again, if it is only in one ear and it's not severe, and the kid is age 6 to 23 months, um, or if they're a little bit older, then there's always the option to withhold the antibiotics and to wait and see. And that's the general kind of way that it works, is that if you wait and see, if you go in and you take a look and the kid has had an issue for a little bit, and you wait and see for somewhere between 48 to 72 hours, that is typically a good situation. Because again, this is one of those things that in most cases that actually clears up on its own. So to give antibiotics when a kid doesn't need it is something to talk about with your doctor. Again, I'm not saying that you need to confront them and all that other kind of stuff, but it's okay to question and say, "Are you sure that they actually need the antibiotics?" Because if they do, great. If it's bilateral, if they meet those other criteria, then for sure. But if it's just on one side, then maybe not. So there's other things that goes along with it too. Um, there was something called Choosing Wisely, which is basically a organization or a campaign that was created as part of the American Board of Internal Medicine, and basically they wanted to improve quality healthcare because there's a whole bunch of different things that can be overused. And with the Choosing Wisely, there ends up being 70 different specialties and societies that have identified common problems that end up being an issue within their specialty and things that end up being overused. So, like for example, chiropractic is in there, and we talk about as there's a couple of different things, but one of them ends up being like you shouldn't order X-rays on a uncomplicated low back pain patient that doesn't have a history of trauma. It's just one of those different things. But when you start talking about antibiotics, again, this is something that's part of Choosing Wisely. Don't routinely prescribe antibiotics for otitis media in children aged 2 to 12 years with non-severe symptoms where the observation option is reasonable. And again, that observation option is going to be just deferring to do antibiotics for that 42 to 78 hour period and just limiting to maybe caring for the pain. So again, this is obviously hard because a lot of parents want to take care when your kid looks like that. You want to do everything that you can in order to try to help them out and help them feel better. But sometimes it's trying to take care of the pain and not necessarily deal with the antibiotic in and of itself. And the reason why is that there are specific reasons that you may want to avoid antibiotics. Again, many of the cases of acute otitis media, again, the AOM there, is that they're not bacterial. Many of the cases of ear infections end up being viral. The other thing is that and this is the one of the reasons for society as a whole, but overuse of the antibiotics will have the tendency to lead to antibiotic resistant bacteria. So they're on multi-generational like steps of drugs in order to try to find it, because the bacteria have the ability to evolve resistance so that they don't work. And if you keep using the same bacteria or the same antibiotics on bacteria, then it completely doesn't work. And then it doesn't work for a patient when they have another type of infection that ends up being problematic. So there's a whole bunch of stuff that can go in with that. The other thing is that antibiotics can involve serious side effects. So um, basically, uh, I skipped one. I'll go back to that. But the use of antibiotics can involve serious side effects. So when it comes to kids, kids in general are about 4 times as likely to develop asthma if antibiotics are used in the first year. Again, that's a big increase. Again, it can lead to a bunch of different stuff, but again, kids that have antibiotics within the first year have the tendency to, be a little bit more prone to developing asthma. And again, whether or not that's going to be specifically due to using the antibiotics, or if it was because that kid might have more issues with health or other kinds of stuff. There's a couple of things, but again, that's something that ends up being an issue. So going back to the studies about finding antibiotics to be ineffective, that ends up being kind of a big deal, because one study found that in 17 different kids that ended up being treated, again, the general idea um, is that of those 17 kids, I'm sorry. The way that you want to look at it is that in the way to look at preventing a kid from getting pain after 2 days. So in order to make sure that one kid doesn't have pain, you have to treat 17 kids in order to do it. So if you treat, basically 18 kids, one kid out of that is going to actually get the benefit from not having pain after 2 days. All the rest of the kids are going to end up getting better regardless whether or not you treated them with antibiotics or not. So again, it's one type of reason, or one way that you might want to look at not actually having antibiotics as something that's the option to treat. Now, when it comes to tubes, tubes end up being a different kind of a subject. So the way that they look at tubes is that tubes are used in chronic type of cases of otitis media. So somebody that continually gets otitis media over and over and over again, they'll recommend it if they end up having some degree of hearing loss, but if it's greater than having 3 months of effusion, or that's again the swelling that ends up happening in the ear. And again, it's one of those crazy kind of things that they found that one of the reasons that you should be careful when it comes down to it is that when it comes to otitis media, is that it has the tendency to not necessarily be super effective. So otitis media, or tube insertion in that in kids that are younger than 3 years old, that inserting a tube in order to prevent any ear infections, it didn't change the developmental outcome. So it didn't make it so that kids did better by getting less infections over that time, or they didn't suffer from the standpoint of having too many um, having too many infections where it made it so that they were delayed in hearing or speech or any of the other kind of things. So again, it's not going to be completely effective to you know to necessarily make it worth doing, especially if there's another option. Again, if there wasn't any other option, then again, you might be able to, if there wasn't anything else that might be able to help to reduce the pain or reduce the frequency of some of these things, then yeah, then maybe it could be worth doing the tubes. But and it depends on every individual case. But in some cases, it might be a good idea to try something that might be a little bit more conservative, that might be more of like a physical medicine type of a thing, rather than trying to go to do surgery and poke a hole into it. Because that's the general idea, is that you poke a hole in the eardrum and it helps to the middle ear to make it so that all those secretions can dry up, so that it doesn't actually end up having a place for fluid to collect. It allows everything to like actually either dry up or drain out. And then other complications that you can get with the tube is that there's the risks of being under general anesthesia, and in general is not good. TM stands for tympanic membrane, so scarring of the eardrum, and then hearing loss are all different things that can happen with people that get the tubes inserted. And it's not necessarily like super, super common, but those are definitely risks, and those aren't necessarily always brought up as part of like an informed consent. They should, but I'm sure that they don't all the time. So I'm not going to try to make crazy kind of um, claims when it comes down to it. But when it comes to chiropractic care, the general idea is that you can use manual techniques in order to clear out stuff. And I got a little bit of something in there. The thing that's listed there is the actual tubes. So sorry about that being in the middle of the screen. But again, the main cause of ear pain, again, is that specific incidence and prevalence is not known. We don't know how often the people necessarily get it. There's a whole lot of different causes, and they can be separated into two different types. So again, the most common thing that's an issue ends up being otitis media. The other thing that can be related to that is going to be that eustachian tube dysfunction. And again, um, when it comes down to it, again, ear pain is going to involve, to a point, the musculoskeletal system and having dysfunctions in the musculoskeletal system. So, manual therapy and other issues can have the tendency to um, help. So, one study showed that 93% of the participants had an improvement following chiropractic adjustments, and then 43% of them after only just one or two sessions. So, in the one study, again, 93% had improvement, and then 43% of that 93%, 43% of the people in the study got improvement after only one or two sessions. So what that's saying is that this is not something that should be looked at hey, your kid ends up having ear infections, you need to get them adjusted 3 times a week for 6 months, or some other ridiculous kind of thing that somebody might come up with. This is looking at trying to do an adjustment in order to get that pharyngeotympanic tube, which this isn't the best view because it's behind some of the bone, but you're trying to get that pharyngeotympanic tube opened back up so that you can actually do so that you can actually get that drained out. So basically, again, this is the general way that it works: is that the fluid that ends up being here in this middle ear is supposed to drain through the eustachian tube. That eustachian tube diameter is going to be controlled by different things. Again, it's going to have something to do with the amount of swelling that's available, but down inside of the throat, in and of itself, you're going to end up having a muscle that's called the tensor veli palatini muscle. So you're going to also have other kinds of places where there's another muscle that is going to control it, which is called the levator veli palatini muscle, and then the subpingiopharyngeus muscle. So again, there's a bunch of different muscles. They're controlled by different nerves that are going to be coming out of the brain. And the general idea is that when people end up having problems with the way that their joints in their neck move, is that that can actually lead to some other irritation for the areas that are surrounding it. So the muscles that are associated with the back of the throat can actually end up being in spasm because of issues that a person might have with their neck. So whether or not it's sleeping in a bad position or having other kinds of stuff that's going on, if you end up having restrictions in the way that your neck actually works, then that spasming that you might have in some of the muscles in the neck could be related to problems with contractions or spasms in the muscles that are in the throat. So again, that tensor veli palatini muscle, the levator veli palatini muscle, and the salpingopharyngeus muscle. And the idea is that with any of those muscles, those are going to be the ones that are going to be the ones that contract in order to open up the eustachian tubes when you yawn or such, or like when you're chewing. Those are going to get fired up to a degree so that you're going to end up getting the movement of air that goes back and forth. So if those are going to be if those different muscles are going to have increased tone, that can result in a little bit of a constriction or a closure of that uh, of the basically the eustachian tube, or the tube that's going to go from the middle ear to the back of the throat. So again, when that effusion happens, or when the swelling happens, or the backup of fluid happens, again, you can get that to be painful, but there may not be any infection. So you could get a buildup of fluid without an actually infection in some cases. Again, if that sits there for long enough, then the fluid can get infected with some kind of a pathogen, whether or not it's a bacteria or a virus. The antibiotics, again, are often used at that point, but just because they're used doesn't necessarily mean that it's going to be super effective. But again, the underlying cause ends up being effusion in many cases, and it's just the buildup of fluid. And if you can get the fluid to be drained, then you can end up taking care of the ear pain. But that was one of the reasons why you end up getting multiple different courses of antibiotics in some kids, because they're just using the antibiotics and they're going after that effusion or the backup of fluid. But if there's not any actual bacteria in there, then um, it doesn't really help it. So that's why one of the reasons why it can happen multiple different times. So, and again, the spinal adjustments can help to remove those restrictions in the neck, which can help to basically reset the system and allow that fluid to drain through the eustachian tube after you get some of those muscles to relax. So again, this is the general kind of idea. And again, just like it shows, you get a restriction in the neck. That restriction in the neck can end up getting a myospasm or a contraction of some of the muscles. You can get occlusion of the eustachian tube, or where it ends up getting plugged up. You end up getting a pooling of the fluid that happens in the middle ear. And at that point, you can end up getting pain and other kinds of issues, but you can also get a bacterial or a viral growth and infection. Use the antibiotics in order to kill the bacteria. That ends up leading, in some cases, because you didn't really take care of the cause of that spasm and the other issues that are associated with it. So it gets blocked up again, and then you end up having that bacterial or the viral growth and the infection, and then it leads to more antibiotics, and it ends up being a nasty cycle that continues and proceeds over and over and over again. So there is research behind getting adjustments and why it can actually be effective. So again, most cases typically resolve in 10 days. Again, a lot of times it will take less than 5 adjustments, and many times it's only going to take 1 to 2 adjustments. Again, 43% of the kids end up getting resolution within basically 2 adjustments. So, and again, in the RCT is the randomized controlled trial. Again, you have 57 kids in that. And again, the kids that received manipulative therapy or gotten adjustments had fewer episodes of getting ear infections. They had fewer surgical procedures, and they had higher rates of the normal tympanograms other compared to the standard pediatric care. So again, having less of that ends up being obviously a good thing. If you're having less surgical procedures and having fewer episodes of having the repeated over and over again, that ends up being good. Again, there's the randomized controlled trial, there's case series, there's case studies for well over 450 different patients throughout literature that shows that chiropractic care and spinal manipulation can help kids that end up having otitis media. So there's multiple different cases that you can get. There's some that were basically published in a journal, like the Journal of the Canadian Chiropractic Association, where they talked about one woman who was 26 who had bilateral ear pain. She had it developed again slowly, but over about a month. She had gone to an otolaryngologist. She didn't find any intraoral pathology that would explain the symptoms. She got diagnosed with TMJ issues, an upper cervical joint dysfunction, and trigger points. And they treated her with manual mobilizations of the TMJ, manipulation to the upper part of the neck. Um, and basically, in this case, the manipulation didn't involve the adjusting with like the fast movement, and so there wasn't any cracking because she didn't like it. Um, so she was given some other different cases, and then after 5 treatments, she reported herself to be 90% improved. Again, the pain intensity dropped down to a 2. from where it had been. She had two different exacerbations over the following month, and then each time she ended up getting treated and they ended up being resolved. And then when she was followed up with 2 years later, she hadn't had any further exacerbations. Um, Again, another kid that was a kid, an 18-year-old woman who complained of left ear pain. Again, this had begun about 3 months before she had gotten treated. She woke in the morning with it. She had also seen an ENT who didn't find any other intraoral pathology. Um, Again, nothing that explained the symptoms and had any issues, and was she was actually referred to a chiropractor for a consult. Again, the pain was localized to the ear. It was rated at about a 7 or 8 out of 10, and the pain was pretty much constant. And she had issues with again, a gushing sound that she would hear, but she didn't really have any hearing loss. And again, after she got adjusted, the pain was much better after the first adjustment. She got seen twice more with the manipulation, again, of the ear and of the neck. And basically, she was doing some other self mobilization maneuvers to the ear. And after 3 treatments, it was completely gone. Again, 10 months later, she hadn't had any other symptoms. There's a couple other ones, but I'm not going to talk so much about those. There was one case that always pops out for me, of a little girl that her mom brought her in to see me. Um, Her, like, this is not something that I advertise. Usually, it's not like I push this with patients on a regular basis. Um, but the mom had actually gone to see she had been talking to a friend who, because her daughter had had multiple issues, she even had tubes and other kinds of stuff in her ears, but continued to get ear infections even after getting the tubes in. They had talked to a friend, and the friend basically told her to take her to her chiropractor. So she asked me if I would treat her. I had to bring her in. I did an exam, did all that. And again, the girl was probably about two ish, 2.5 at the time when she came in. She had a lot of different restrictions in her neck. And after adjusting her, um, I mean, this was literally one of those things where the mom brought her in and she was desperate because the little girl, she said that she had only slept for about 4 hours total over the past couple of days. So you can imagine a 2.5-year-old that, had gotten little to no sleep. She was basically a terror, and she was, crying all the time, and it was just bad. And after I adjusted her, the mom called me the next morning and told me that she basically was um, she called me the next morning and she basically told me that she had slept for 10 hours the night before. So that was one of those kind of things that was pretty darn cool, to have her go from not being able to sleep at all to sleeping for 10 hours and actually getting the rest that she needed. I adjusted that little girl 3 times, and she was fine after that. She didn't have another ear infection. She didn't have any other problems after that. Um, so there's home remedies and other kinds of stuff that you can use as well. So again, it depends on the cause. Again, if there's something like a cavity that's to blame, then a home remedy isn't going to be something that's going to help. But if the cause is the ear infection, then again, a natural remedy might help to make the illness a little bit bearable, and you might be able to deal with some of the pain. So again, infections will clear up on their own in about a week or two, typically. So again, symptoms usually start to get better after a few days. So besides doing adjustments, there's other kinds of things that you can do. And again, it depends on the kid's age. So if the kid is under the age of 2, it's probably a good idea to make sure that you get them in. It's probably not a bad idea to make sure that you get them in no matter what. But during the wait and see portion of the issue, or if the kid has had recurrent kinds of things, then again, getting adjusted may be a good idea. But besides that, there's other home remedies that you can use. So again, these have been used. Multiple different people have used them over. Some of these things have been used over 100 years. I'm not going to make any claims on, like, research backing all of this stuff up, but these are kind of anecdotal things that people have used over the years in order to help somebody out. So one of the things that you can use is to use some drops of warm oil in the ear canal might help to ease the pain. Again, this is not to be done, and it shouldn't be done if you end up having tubes in the eardrum of a kid. So if you end up having a ruptured eardrum, or if it ends up getting opened up, then this isn't a good idea to do. But again, a few drops of warm oil in the ear canal can help to ease the pain by soothing the inflamed eardrum. Um, Again, for a baby, you can do this when they're sleeping to ensure that it's in an upright position. So again, if they're sleeping and they're laying with that side ear up, again, you can put that in for a few minutes and allow it to get down and to reach the eardrum. Again, it's not going to harm their hearing. Again, as the auditory structures are on the opposite side from the eardrum, again, you can let gravity be your friend. Again, the American Association of Pediatrics um, suggests that if you're going to use this, that you make sure that the olive oil is no warmer than body temperature by using a thermometer. You don't want to warm it up and obviously cause a burn when it comes to this. So again, because the eardrum is going to be thinner, so it would also be more susceptible to getting burned than just skin. But again, note that eardrops or olive oil should not be used if it's been burst, because again, that's not going to help. Um, Something that can be helpful is that you can add garlic to that oil, and basically you can marinate the garlic in there for a little bit and use that because again, garlic has both antibiotic and pain relieving properties to it. So one study had found that eardrops that contain garlic, among some other ingredients, were just as effective as over-the-counter eardrops. Again, to use the method, again, you would basically take garlic, crush it up, soak it in warm olive oil, or you can even use sesame oil for several minutes, and then you would strain the garlic out, and then you would apply that oil into the ear canal. Again, letting gravity be your friend and drop it all the way down and in. Tea tree oil can be something that you can also use. Um, and depending on who you talk to, again, you may want to do it specifically, with the tea tree oil in and of itself. But in some cases, people do get sensitive to tea tree oil. So you can always add a few drops of the tea tree oil in with a small amount of olive oil and add that in to cut it down a little bit. But tea tree oil has been found to have antifungal, antiseptic, and anti-inflammatory type of properties, as well as antibacterial properties. So again, you can use that and apply it with the eardrums to help to reduce pain and discomfort. So another one that you can do, and again, I would be super careful doing this, but this is basically like using a neti pot for adults, where you could use a infant and you can squirt a little bit of salt water into the nose. Again, a little bit. You don't want to use too much, but you can basically put a little bit of salt water into the nose and then use suction in order to get the nasal secretions moving in order to reduce swelling and maybe even unplug or drain that eustachian tube. In some cases, there's a mucus plug that can actually develop on the inside part of the back of the throat. And sometimes using the salt water can actually help to unhook that so that you can actually get draining. So, uh, one of the things that a chiropractor can do is that you can actually adjust an ear. For you guys, I wouldn't recommend trying it for somebody who hasn't been trained, but you can actually adjust an ear. But for a patient, you might be able to take a child, or you can even do this to yourself and do a little bit of manipulation, because by pulling on the tissue around the ear, it can pull down into the ear and it can actually start to move around that eustachian tube, and it might help to open it up in order to get more draining to happen. So, children who suffer from chronic sinus infections and stuffy noses, like allergies and stuff like that, again, they can benefit from a gentle ear wiggling. So, you would basically grab the earlobe between your thumb and your forefinger, and then you would pull down and out a little bit a few times. You would have it move back and forth a little bit. In some cases, when someone does this, there might actually be a little bit of a pop that happens where the eustachian tube might actually open up, and you might actually hear it, and that might allow the fluid to drain. Not saying that that is the goal and that you have to hear a pop, but sometimes that does happen. So if it did, I wouldn't freak out about it. So, but again, it's a gentle pulling. It's a little bit of a tugging that's going to happen. The ear's going to just basically wiggle. So the maneuver is going to be similar in effect to the yawning or swallowing or the nose blowing, where your ears kind of pop and they open up. Uh, when you're doing that. So a warm compress can be something that can be helpful. Again, a heating pad or a damp washcloth that's going to be heated up. Again, you can use that to relieve pain in the ear. Again, this is going to be safe for both children and adults. In order to do this, basically, you would take the compress and you would put it over the ear. And again, you can also alternate sometimes between using hot and cold as well. But again, you can just you if you want to, you can just use one of those and just put it on there for about 10 minutes or so. Leave it off for about 20, 30, 40 minutes, and then you could reapply it. Again, it depends on how much that you have that's an issue. Again, hydrogen peroxide ends up being something that also is something that can be used. This has been used as a natural remedy for many years. Again, basically for this is that you're going to place several drops of hydrogen peroxide into the affected ear, and then you would let it sit for several minutes before you would basically let it drain out into a sink, and then you would rinse the ear with clean water after that. You got to make sure that you rinse it to make sure that there's nothing residual or left over. Over the counter painkillers can also be something that can be helpful. The American Academy of Pediatrics is going to that they suggest that you can use over the counter pain relievers like ibuprofen and acetaminophen in order to help to control pain in in acute otitis media. Again, they're safe to use with or without antibiotics, but you have to obviously be sure that you're following those dosing instructions on the label. Some of those medications, again, ibuprofen and acetaminophen, both of them can be used to lower a fever. But again, with the whole fever thing, you also want to make sure that you are taking them in to the pediatrician to make sure that things are all right. Again, you want to talk to the doctor about the appropriate dose. Uh, in order to make sure that everything is good. And again, there's obviously child and infant versions that are available for the over the counter pain relievers. But the thing to remember is that it's not safe to give kids under the age of 16 aspirin. So, normal, like kids shouldn't be taking aspirin on a regular basis. So, another thing that's obviously a good thing that's just being a good parent, obviously, is going to be trying to distract the kid. So, if they're in the middle of battling an earache, try to get them comfortable by taking their mind off of the pain. Try to put on their favorite movie or their favorite show, even if you don't like it. Maybe try to get them playing outside or bring home a new coloring book. You can let them play a game on your phone, like with my kids. That's like golden for them because they never ever get to play on an iPad or anything like that. They barely ever do. You can get their favorite type of snack or some other thing for them to focus on would be the way to do it. Again, if your child is of the teething age, again, if you have toys that can be cooled down, that can be something that can be helpful as well. Cigarette smoke. Cigarette smoke is obviously a big no-no. Again, that's one of the risk factors that goes way up. It increases the likelihood of a kid getting an ear infection um, by about 25%. And again, that ends up being a big deal. So not only should people not be smoking around your kid, but again, I would even encourage somebody to go to the point of if you have somebody who is a smoker that is going to be spending time around your child, I would encourage them to wash their hands, wash their face. I would encourage you to have them wash their hands and their face and even change their shirt. Especially if they're going to be holding the kid, because again, everybody knows that that smoke can just sit in the clothes. And again, if somebody's going to be fussing with the baby, you don't want them messing around. That's my personal thing, but everybody obviously is different when it comes to that. Um, there's other stuff that comes down to it is that there's environmental factors that can play a role. So there's things called food intolerances or allergies. There's a there's a general idea people know about food allergies when it comes to like peanut allergies and like soft shell crab and like like the seafood type of allergies, bee stings. Those are the allergies that people typically think of, but those are what we call immediate onset allergies. But there are other types of things that some people don't like to refer to them as allergies because they don't have like the same kind of anaphylactic type of reactions that happen with them, but they still end up being issues that people have with food. And this is not like um, like a lactose intolerance kind of a thing where it's like the with lactose intolerance and stuff like that, that is the person isn't able to digest the food, so it ends up causing like bowel trouble and other kinds of stuff like that. I'm saying that the person is actually reacting to a food. So in some cases, again, if this is happening over and over and over again, I wouldn't recommend it if it's like the first time with a kid or something like that. But it might be something that a kid might react to soy, they might react to wheat, they might react to dairy. So like cow's milk might be a problem for them. And again, when it comes to formula and other kinds of stuff like that, there can be all kinds of issues that are associated with that. But it could also be, depending on the age of the kid, it might be something that they're fed on a regular basis that you wouldn't even think, like strawberries or melon or, something along those lines. So there's a bunch of different things that are there. That would be a situation where you may want to look into getting tested for it. Again, you know that that's a little bit different. There's going to be many people who aren't going to necessarily you know be behind that. But again, if you've had multiple different issues and you're still trying to find what the problem with the person is, or with your kid is, then sometimes finding that out, and then basically you find out what the person tests positive for, and then you basically are going to cut that out of the diet for a couple of months. And then if you are going to remove that from the diet and then you challenge them later on and give them the food, if some of the issues come back, then you know that it's, obviously part of the problem. So that's one thing. It just gives people, when it comes to uh, doing that, it makes it a little bit easier to do it. There's other environmental allergies or other stresses that can be problematic. And again, we've already talked about cigarette smoke, but again, that can be issues with um, kids and pets with different kind of household cleaning products, laundry products, and different stuff like that. Many of those things can lead to an inflammation of the adenoids, and that inflammation can block the opening of the eustachian tube. That's what ET means there. So there's multiple different things that kind of go with that, with the environment, that are things to think about. So to kind of recap here, when it comes down to it, again, there's multiple different reasons to call the pediatrician immediately. There's multiple things that you don't want to mess around with. You call your pediatrician, you obviously go from there. If they end up thinking that it needs to get an antibiotic, and you can ask them whether or not it fits and all that kind of stuff. Again, being an advocate for your kid is different. And again, I'm not expecting someone to argue with their pediatrician, but um, you know, again, you don't want them to just be handing out um, antibiotics like candy. But that being said, again, the reasons to call and get your kid in to see the pediatrician is if the child is younger than a year old and and you think that they have an ear infection, that they're doing that stuff where they're tugging on their ear or they're playing with it, or if they can't hear you necessarily the way that they should. If they're older than 1 year old and they have an earache and a fever, if they have something stuck in their ear, you would want to call. If they have an earache along with a stiff neck, and again, this is going up to like 12 years old. If they have an earache along with a swollen or red skin that's behind the ear, that could be like mastoiditis, and that's again something that's not a good thing. If you have an earache along with dizziness or with difficulty balancing, get them into the pediatrician. If you have a acute earache that causes crying and then pain relievers aren't really helping to take care of it, then that's another reason to get them in. If there is pus or blood that's coming out of the ear or is on the pillow, from the ear, again, that can be an indication that the eardrum is ruptured. You need to get that evaluated. And if the person still has an earache or a fever after 2 days of a treatment with antibiotics, then those would be other reasons to get in. And obviously, if you did the wait and see, if you decided to take your kid in and then you decided with the pediatrician that it's a good idea to not have them um, to not put them on antibiotics for whatever reason. And again, if you go in and you wait that 48 to 72 hours, then that would be appropriate. If they still had it, at 72 hours, then that would be another reason to take them in. And at that point, obviously you'd want to, do what you can in order to get rid of it. And if that includes, getting the antibiotics, then that's what you need to do. Again, when it comes to running the fever, again, if your child is running a high fever, or if the fever lasts longer than a day, then you need to seek immediate medical care. For a kid, a high fever is going to be recognized as if it's a rectal temperature, if it is higher than 100.4 degrees Fahrenheit or 38 degrees Celsius. Um, if or if it's greater than that. So if it's greater than the 104 or 100.4 in an infant that's less than 3 months old. In a kid that is 3 months to 3 years old and the rectal temperature reads 102, then that's a reason to take them. Or if in a kid that's over 3 years old, if the rectal, or forehead temperature reads 104 or greater, then that's the reason to take them in when it comes to that. So those are all reasons to make sure that you take them in to see your pediatrician. Again, this is one of those kind of things that I know that is controversial. There are some people that talk about that you should go in and again, not like the picture here, you want to shove it all the way in underneath the tongue. But when it comes to this, I know that people, there's a lot of chiropractors and a lot of providers, or I should say, there's a lot of chiropractors that'll tell you that you should come in and you should get adjusted first and all that other kind of stuff. Again, there's reasons to get adjusted, and then there's not. I'm not going to be sitting here and saying that there's overwhelming evidence that a child needs to get adjusted when it comes to an ear infection, but there is a decent amount of studies that show that it is something that's helpful to reduce the frequency of getting ear infections and the number of kids that end up needing surgery due to getting chronic ear infections. So that's one of the things that I look at. So when it comes down to this, if anybody has any questions, obviously we could do it on a chat, or if you have questions and you want to put it down below later on when this is on YouTube, then obviously go ahead. I'd like to thank you for listening to the talk. We love sharing on different topics and different stuff like that, and I want to help people transform their help and help get better. So if you have any further questions, go ahead and post them down below. I'll try to respond to them. And if you have any questions, or if you want to get in contact or take a look at our blog or any of that other kind of stuff, you can go to besttoledochiropractor.com. Thank you very much, everybody, and I will talk to you later.